We are now going to discuss Part 1, Effective Delegation and Supervision, Chapter 19 of your textbook. Here are a few comic strips reflecting how delegation can appear at times. In actual reality, delegation is not a new concept. It goes back as far as Florence Nightingale. Because the RN is most often responsible for coordinating care provided by the various team members, he or she must clearly understand and be able to effectively use the management process of delegation and supervision to ensure high-quality, safe patient care. We're going to discuss the different aspects that affect delegation and supervision in the healthcare system. Before we start the process of delegating, one must understand the issues that affect delegation, starting with staffing patterns. Staffing patterns are affected due to reduced reimbursement from Medicare, Medicaid, and private insurance companies. We have a growing uninsured population. Even though we have the Affordable Care Act, which was supposed to fix this, there are still millions of uninsured patients. We need to focus on safety and quality. And then, of course, you have the rapid advances in medical technology and the increase in patient acuity and complex treatments. With the increased use of unlicensed assistive personnel, this forces the RN to delegate more nursing tasks. And the roles and responsibility of care providers such as RNs, LPNs, LVNs, or UAPs, they are significantly overlapping. Other issues that can affect delegation are healthcare errors. In healthcare errors, nurses are recognized as having a strong effect on improved patient outcomes through patient monitoring, education, therapeutic care, and intercepting healthcare errors. Delegating tasks safely is essential to allow nurses time to attend to the most important aspects of professional nursing care. And economic necessity. When looking at economic necessity, we need competent, appropriately supervised, unlicensed assistive personnel and LPNs or LVNs in patient care. RN's confidence with delegation and supervision skills is essential. RNs must be able to understand the legal responsibility that is related to delegation and supervision. Managers sometimes will feel overwhelmed with all their job obligations. They will need to learn to delegate. So what is delegation? Delegation is the transfer of responsibility for the performance of an activity from one individual to another while accountability for the outcome is retained. It is legal and management concept. RN transfers responsibility and authority for the performance of an activity but remains accountable for the overall nursing care. The management strategy used to ensure the accomplishment of cost-effective patient care. This is delegation. Delegation is a two-way process. RN delegator is responsible for the following: the act of delegation, supervising the performance of the delegated task, assessment and follow-up evaluation, and any intervention or corrective action that may be required to ensure safe and effective care. And the delegatee is accountable for the following: his or her own actions, accepting delegation within the parameters of their training and education, communicating the appropriate information to the delegator, and completing the task. So, what should not be delegated? Well, unfortunately, there is no definitive list. It varies among states, organizations, and specific situations. But remember, assessment, evaluation, and nursing judgment cannot be delegated. RNs have to seek guidance and integrate information from state nurses' practice acts, patient needs, job descriptions, employee competency, policy and procedures, clinical situations, and professional standards of the nursing practice. The State Nurse Practice Act will provide guidance for legal delegation. Delegation criteria may not be clear or may be presented in various parts of the Act. The State Board of Nursing may offer guidance. The RN should understand the legal scope of practice for an LPN or LVN. Practice by an unlicensed assisted personnel is generally governed by the healthcare organization standards. Now we need to look at the patient's needs. RNs are required to perform a patient assessment and to know the level of care required. Generally, the more stable the patient, the more likely delegation is going to be safe. There are many tasks that can be delegated that may be intertwined with the nursing responsibility. Know the job descriptions. It delineates the tasks, duties, and responsibilities that are required as a condition of employment. They generally comply with state laws and the healthcare organization's standards of care. The RN should be aware of the job training required to function as described in the job description. In all cases, legal requirements related to delegation supersede any organizational policy or job description. Competencies. Staff member must have the skills and knowledge necessary to perform a task before it is delegated. Competencies confirm that the individual has demonstrated specific knowledge and skills. Regulatory and accrediting agencies such as the Joint Commission require written documentation of staff competencies. RNs should be knowledgeable about the documented competencies of staff members whom they supervise. Competencies for an ambulatory care clinic can include medication management, telephone triage, infection control, glucose testing, and or reporting abuse and neglect. Then we have organizational policies and procedures. The specific skill and supervision requirements for various tasks are designated in written policies and procedures. These ensure that the delegatee is trained and understands the organization's general standards of care. One example, infection control. So let's look at the clinical situation. Does the unlicensed assisted personnel or LPN or LVN realistically have time to perform the task? Is the staff member familiar with characteristics of the patient population? How complex is the task? Does individual have the resources such as supplies and equipment to perform this task? Can the RN provide an adequate level of supervision? These are just some of the questions you'll ask yourself before delegating. Let's briefly review professional standards of nursing practice. Agreed on levels of nursing practice as determined by the ANA and specialty nursing organizations. ANA standard states that in delegation, the RN will consider the following: assessment of the patient's condition, capabilities of the nursing and assistive staff, complexity of the tasks to be delegated, the amount of clinical oversight or supervision the RN will be able to provide, and or the staff workload. The ANA also lists activities that the RN cannot delegate. They cannot delegate initial and any subsequent assessment that requires nursing knowledge, judgment, and skill, determination of nursing diagnosis, establishment of nursing care goals, development of nursing plan of care, evaluation of patient's progress, health counseling or teaching, or activities that require specialized nursing knowledge, skill, or judgment. This concludes part 1 of effective delegation and supervision. If you have any questions related to course content, contact the instructor.